Thank you for tuning into NorthPoint, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we are joined by two guests. First, we are joined by Dr. Carrie Nedrud, who is a pediatrician from Arizona. She did medical school at the University of Arizona and a pediatric residency at the University of Colorado. Dr. Nedrud loves working with children of all ages, from newborns all the way through teenagers and young adults. And some of her special interests include speaking Spanish, providing comprehensive, equitable care for all children, helping breastfeeding moms and babies, providing primary care for premature infants, and working with teens on their mental and sexual health concerns. She's moved to Minnesota to be close to family and is thrilled to be part of the team at NorthPoint. We're also joined by Kathy Kreitzer, who is a pediatric nurse practitioner. She did her training at the University of Wisconsin-Madison. She loves working with families, especially following them from newborn through adolescence. She moved to Minneapolis in 1994 and has worked at what was previously called Pilot City and now at NorthPoint since that time. She learns something new from her patients every day and has enjoyed watching the clinic and staff grow and learn together. So welcome to Dr. Nedrud and to Kathy. We're here to talk about vaccines and immunization awareness. So thank you for joining us and agreeing to answer some of our questions.
Thank you so much for having us.
Thank you.
Absolutely. Yeah. So let's just dive right in. Let's talk about vaccines and how they work, and tell us specifically if they work against viruses or bacteria or both.
Yeah, that's a great question. They work by priming your immune system, so kind of teaching your immune system what to look for, what invaders to look for, so that you essentially can develop like a smart bomb to only target those things. They do work against both viruses and bacteria. There's multiple types of vaccines. One is called an inactivated vaccine, which is pieces of a virus or bacteria or that are completely dead, that don't have any ability to cause infection. But you show those to your immune system, and it teaches your immune system how to recognize them. So if you do come across that infection in the future, your body's all revved up and ready to go before it ever causes illness in you. There's other ones called live attenuated vaccines, where it's a weakened form of one of those invaders. And those, again, are shown to your immune system. Your immune system can usually fight them off without causing an infection. But in an immunocompromised person, that one might cause an infection. So we don't give those vaccines to people who are immune compromised. We only give the inactivated vaccines to them. The inactivated vaccines sometimes need extra doses or things to be completely effective. And we also have toxoid vaccines, which are to help fight against the toxins or poisons that some bacteria and viruses create. But importantly, when you're thinking about vaccines, there's two groups that need to be protected, the individual and the whole group. We call that herd immunity. And so if we think of vaccines in the context of rain, if we think of germs as being the rain that's falling down on us, we want to wear a raincoat. But if you're wearing, and that's like your own personal vaccination, you're wearing a raincoat. But if you're wearing a raincoat, you can still get your head wet. So then you also want an umbrella. An umbrella is kind of how we all work together as a community. If we're all vaccinated, or the vast majority of us are vaccinated, we kind of buy ourselves a community umbrella that we can all shelter under. The people who don't have raincoats can also benefit from that umbrella and can be sheltered under it. So for example, like children, young infants, we don't make raincoats for them. They're not eligible for vaccines when they're very young, but they need that protection. And so we're keeping them under the society umbrella to keep them safe. And so I think it's important for us to think of it not only for our own personal safety, but for the safety of our whole community, that we work together on getting this herd immunity.
Absolutely. Thank you. And tell us why vaccines aren't always 100% effective.
Well, first of all, vaccines are very effective, and they're our most important public health measure that we have. and the number of cases of vaccine preventable diseases has plummeted since childhood immunizations were introduced. And as Dr. Nedrud just said, they're designed to pump up the immune response. But since everybody's immune response is different, not everybody is able to pump their immune system to certain levels. So the immunity varies from person to person. I just wanted to point out some of the most impressive declines in vaccine preventable diseases are diphtheria, Haemophilus, measles, rubella, and smallpox, all over 99%, and in fact, smallpox 100% decline.
Okay, thank you for clarifying. So very effective, yes. Tell us about the number of vaccines out there, maybe why there are so many, and let us know maybe the most important ones.
Yeah, currently the U.S. Child vaccination schedule includes 14 infections that we are protecting against in that birth to 6-year-old age range. And here at NorthPoint, we recommend all of those. We're following the CDC guidelines and all the science that has gone into developing those. Those infections are hepatitis B, which is a liver infection, and then diphtheria, which is a throat infection, tetanus, which is lockjaw, or what you get if you step on a rusty nail, pertussis, which is whooping cough, polio, which is a disease that can make you paralyzed, Haemophilus, which is an infection of the brain, the lungs, and the blood, pneumococcus, which is another infection of the brain, the lungs, and the blood, rotavirus, which is a infection that causes diarrhea, measles, which causes a rash and complications of neurologic complications, mumps, which is a gland infection, rubella, which is another rash infection, varicella or chickenpox, a rash infection, hepatitis A, a different liver infection, human papillomavirus, which is for genital warts and cancer of the uterus, meningococcus, which is for infection of the brain. And then if you travel or have other immunocompromising conditions, there may be other vaccines that would be recommended as well. And I mean, the question about which ones are most important is sort of hard to answer because they're all important. They've all been developed for good reasons. And I don't, I would recommend getting all of them. I gave them all to my children. I've had them all. Like, just for example, some of them people are like, oh, well, I don't need hepatitis B because I don't have it or whatever. Hepatitis B is a liver infection, but most people don't even know they have it. And then later on, as an adult, they develop liver cancer and ultimately have liver failure, need a transplant, or die from their cancer. And so there's some of these things that you may not see the repercussions for many, many years, but they're still really important and valuable. We do think that when we're giving them is safe and which ones we're giving are safe. And we're definitely happy to answer any of your questions about that when you're in the office.
Absolutely. Let's talk about immunity, which we touched on a little bit. Can you tell us about natural immunity and how it compares to vaccine-acquired immunity?
Yeah. So natural immunity is the way your body fights off infection. And we have lots of different ways that we do that. Our skin is a protection so that germs don't just enter straight into our body. And then we have some infection-fighting cells that just go off on anything they don't recognize. We have some that are very targeted. And so vaccines are helping us to create that really targeted response. So it's vaccine-induced immunity is using our natural immunity it's training our natural immunity so that then we can protect ourselves. And some vaccine immunity wanes over time. We see that, you need to get a booster shot to get your full protection or your lasting protection. And that can happen with certain types of natural immunity as well. And so the biggest benefit is that when you get a vaccine, you don't have any of the consequences of a real infection, so that your body is protected without having to undergo, whatever attack on your liver or your heart or your brain that you would have had from having the actual infection.
Right. And you touched on this a little bit about boosters. Can you elaborate a little bit why those might be necessary?
Sure. Because the length of acquired immunity varies with different vaccines, some providing lifelong immunity and others a shorter term. Healthcare experts have studied these thoroughly and recommend schedules for boosters, and your healthcare provider should be up to date on those schedules or will know where to find the most up-to-date information. So coming in for your regular visits to the medical clinic to be sure you and your kids are up to date is really important.
Absolutely. And we talked a little bit about this, but maybe tell us why we would vaccinate against something that we think is more on the mild side, like chickenpox. What's the benefit?
Yeah, I mean, I think we all think of chickenpox as being a mild rash that a lot of us as adults had as children. And really, I think that's not the reason we vaccinate. We don't vaccinate because we get a rash. I mean, yes, it's itchy and yes, it's annoying, but it's truly not the reason. We vaccinate because before we had the varicella vaccine, 4 million children per year were infected in the U.S. 10,000 of them were hospitalized every year, and about 100 kids died every year that were previously healthy just from chickenpox, because it can sometimes become invasive. It can cause pneumonia and fulminant liver failure. And so those kids, were clearly, it wasn't a minor disease for them. And we don't know which those people are going to be. And then, there's other things like rubella would be a good example, where the disease of rubella is mild, cold-like symptoms in, healthy children. But if women get it when they're pregnant, it can actually cause death of their baby or really horrible birth defects and long-term consequences, severe brain deficits, hearing loss, other things. And so there's some things that we're vaccinating for, not because if a child gets the disease that they would have a serious case, but that if their mother who's pregnant with their sibling gets it, then they could have a serious outcome in that pregnancy. Or so I think all the diseases we're vaccinating for do have serious complications or outcomes. Measles is another one that we don't vaccinate again for that rash. What we're vaccinating for is that some people get measles and they get severe brain complications where they have seizures, they have loss of ability to speak and move, and they can ultimately die from it. And so that's what we're trying to protect from.
Absolutely, thank you. So maybe switching gears a little bit, you can help us clarify or maybe even debunk the idea that getting a vaccine might cause the disease that you're actually trying to be inoculated from. So how would you address that?
Well, from killed vaccines, it's impossible to get the disease from the vaccine because the pathogen was killed. I think some people confuse the side effects they might get from the disease. So it doesn't cause disease if you get a killed virus vaccine. However, live vaccines are made from the weakened virus or bacteria, and it is possible to get a mild case of the disease, but it doesn't cause serious disease in children with healthy immune systems. Examples of live attenuated vaccines are varicella, measles, mumps, rubella, the nasal flu vaccine, and oral polio and rotavirus vaccines.
Thank you. Thanks for clarifying. Kind of similar on the same lines, we talk about all these vaccines that are required for babies. So tell us, can a baby's immune system handle those immunizations early on?
Yeah, and that's something that definitely comes up with the people who are cautious or against using vaccinations. They worry that will cause a problem. But on any given day, your baby is being exposed to like hundreds of thousands of germs. Even if you keep a perfectly spotless house, they're just being exposed to so many things. And so the, 5 or 8 specific germs that we're showing them on any given day when we give them a vaccine are spit in the bucket compared to what they're actually exposed to regularly and what they're able to handle regularly. Even if your baby were to get 11 shots all in one day, they would still only be using 0.1% of their immune system. So it's been extensively studied. We know it's safe. We know your baby can handle it. And the timing is important. We do want to give them early and stay on top of that timing because we're trying to protect them when they're most vulnerable to those infections and making sure that they get that protection they need before they were to encounter that infection.
Absolutely. Yeah. Let's talk about side effects with vaccines. So what is the thinking behind a vaccine that's recommended versus the side effects?
Well, first of all, the most common side effects from a vaccine are fever, fussiness, redness, or a lump at the site of the injection. And inactivated vaccines, the ones from killed virus, might cause an immediate response. So the body is mounting its response to this invader and as if it was being infected. So then the body you might develop a fever, body aches, fussiness. All of those develop usually within 24 to 48 hours of getting the vaccine, and then you're done. If a child or infant gets a fever more than 72 hours after being vaccinated, it's not from the vaccination, and you should contact your healthcare provider. The one caveat there is if it's a measles, mumps, rubella, or chickenpox vaccine, the live attenuated ones, they can cause a delayed response. So long after you had your child in for their measles, mumps, rubella, or chickenpox vaccine, they may wake up one morning with a fever and a rash. And that's telling you that your child is making a response to or their immune system is making a response to the vaccination. Babies are not considered contagious with that rash. And they aren't really usually too bothered by it. There's a very rare side effect of the measles, mumps, rubella of a high fever 5 to 12 days after the vaccine, and it may rapidly rise and actually cause febrile seizures. And those seizures can look really scary to people observing them, like especially the parents, but they don't cause long-term harm to the baby. And then the redness at the injection site is very common, and especially after the 5th booster dose of the DTaP at the age between 4 to 6. And it can be a pretty dramatic redness and soreness, but it will go away within a few days. And then a firm lump may also develop at the injection site that's called fat necrosis. And it's just that the fat got nicked a little bit as the needle was going into the muscle. And that usually goes away within 6 to 8 weeks. And it doesn't harm the child. Then I also just wanted to say that measles, mumps, rubella vaccine does not cause autism. The original paper that claimed that it was linked was retracted, and the author admitted that he made up that information. And there's been many, many, many research studies all over the world that have disproved that connection. And then I just wanted to talk a little bit about very serious side effects, including severe allergic reactions, encephalitis, and death. They're so rare, but experts take those serious side effects to heart and follow them and make sure we're making the right choice for giving the vaccine. Careful watching and calling right away if you're concerned with any side effects you're seeing after the vaccine is important. And then when you take it all in context, some of these side effects are serious, but most of them are mild, and the potential fatal diseases that we're protecting against show us that choosing not to vaccinate has serious risks. So health experts are constantly looking at risks and benefits, one example of that is the oral polio vaccine, because it's more effective than the injectable form. But in the United States, we use the injectable form because the oral polio vaccine, in very rare cases, like 1 in 2.4 million, can actually cause the disease. So in countries where polio is still high, using the oral vaccine, the risk-benefit shows that it's worth it. But in the United States, since there's a very low incidence of polio, using the killed vaccine is what we do here.
Thank you. And similarly, along the same lines, do we do enough testing for vaccines? I think that's something that's concern for parents.
Yeah, we do. There's a very rigorous process that vaccines have to go through, long before they ever get into people. And then when they start getting into people, there's multiple stages of the process where they're watching carefully for side effects, looking for if it's effective, looking for correct dosing and scheduling. And then even after they're out in general public, we have really robust collecting systems to get any information on if there is a negative effect. And healthcare providers report into those, and individuals can also report into those. It's called the VAERS, or the Vaccine Adverse Events Server, I think, is the system that you can report any adverse side effects from vaccines. And so we do think that this is a really rigorous, it is trustworthy, and it's always being reevaluated. Like all science, it's never, we're never done. We're still looking. And so if we ever see that there is a problem, we address it and pull things off the market if they're not safe. So for example, the rotavirus vaccine that was used in the past was shown to, in rare cases, cause intussusception, which is where the intestines kind of collapse in on each other and cause a blockage. And so they pulled that rotavirus vaccine off the market, did more research, developed a safer version that doesn't have that risk associated with it. And so we do think that because in the past, hospitals were full of children with dehydration and rotavirus, and now we almost never see them in the hospital, that it is cutting down on the morbidity and mortality that we were seeing. And so we do think that the effectiveness is good, and that we've made the side effects even less. And so something that we're always reevaluating and looking at.
Thank you. So, last couple questions here. I wanted to talk about disparities, racial and ethnic disparities among immunization coverage, especially of children. Can you maybe provide some insight as to why you think those disparities exist, and maybe talk about why they exist on those lines specifically of race and ethnicity?
A 1996 to 2001 study of preschool kids showed that the gap between white children and black children fully vaccinated had widened 1% per year. Between white children and Hispanic children, it widened by 0.5%, and between white children and Asian children, it decreased by 0.8%. Another study a few years later also showed that overall vaccination rates were lower in those who lived in poverty, those who had mothers who hadn't finished high school, and in Black children. And just recently, the Children's Hospital of Philadelphia has seen that 11 million routine vaccines were missed just due to the pandemic. So connect with us. We'll let you know if your children need shots, and get them to them.
Thank you. And let's talk about NorthPoint as our last question. What services does NorthPoint offer around immunization?
Yeah, we are happy to vaccinate adults and children. If you don't have insurance, it can be covered for free through the Minnesota VFC program.
Mhm.
We can give vaccines, all the routine childhood vaccines and the flu vaccine, in conjunction with your regular visits or as separate vaccine visits if you want. And it's available at all of our sites. We've got multiple different clinic sites, including in the schools, and we're able to get you in any of those places. If you call 612-543-2500, we can get you scheduled.
Thank you. Wonderful. And we'll have that information there below, our number and our website. So this has been really great. Thank you for answering our questions and clarifying. Dr. Carrie Nedrud and Kathy Kreitzer, nurse practitioner at NorthPoint Health and Wellness Center. Thank you for your time.
Thank you.
Thank you.
Thank you for listening to NorthPoint Making Health Happen. We want you to know that we are here to partner with you, that you can dream and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.